Okay, today is Tuesday, December 26th. Still have these cheeks from the hyperthyroid disease. Tomorrow morning I have surgery for orbital decompression, and you can see how my eyes are. Doctor had stated he is going to take out bone, take out the fat, cauterize the fat, some cauterizing. No makeup. There's gonna be a lot of over-the-counter medications and medications that have been prescribed for the recovery and taking back the eyes. He said he's going to take the eyes back about 4 millimeters, both sides. And because of the proptosis, he will take out some of the lid, both top and blepharopathy is what they call it. So this is going to start the journey of years of disease due to hyperthyroidism. I do still have a small goiter, so I wonder if, because I'll be intubated for the process of decompression, removal of the bone behind the eye, and it'll take about 2 hours. I wonder if if I'll be having any pain or any pressure on the goiter while I'm under, obviously with a tube down the air pipe. If that's something that I should bring up. It's obviously not a very large one at all, but it is there, and sometimes it can be uncomfortable if I'm making head movements like this really tight. It is pretty, it can be felt. Sometimes it behaves and it does kind of come down in size. So we'll see. I'm gonna just ask that question about the goiter. Doesn't seem to be much of an issue online. At least no one's really stated that there's interference, or if it's going to break anything or harm anything else that around which the goiter is wrapped, specifically the breathing tube and such, or anything else. So here it starts. These are my eyes. This is basically how they look. Really not. This is not me, of course. This is a very scary appearance. It's actually very painful because of the pressure on the eye coming from everything that has pushed my eyes out. I do have glaucoma, and so this procedure should reduce the pressure immensely. It's going to improve a lot of things as far as medical issues from TED and general hyperthyroidism. Well, I'll keep recording this and make all the comments that are going to be definitely associated. I'm imagining with all the guidelines day by day that they provided from the surgery center, I imagine it's going to follow much to the T of what they've written down, because I'm sure they've learned from experiences with other patients. All right. Good night.